Hi, everyone, and welcome to this conference hosted by MS Focus, the Multiple Sclerosis Foundation. I'm your host, Kimani Hendricks, Multimedia Communications Coordinator for MS Focus. And today I'm joined by Dr. Alan Bowling, who will talk about integrative medicine and MS. After his presentation, we will allow time for questions and comments. Alan C. Bowling is an internationally recognized neurologist, MS specialist, and integrative medicine pioneer. He has over 3 decades of clinical and research experience. He has devoted his career to developing and providing rigorous, comprehensive, and compassionate care to those with MS. Dr. Bowling is the director of the NeuroHealth Institute and the clinical professor of neurology at the University of Colorado. He has more than 100 lay and professional publications, including 5 books. He lectures extensively and is actively engaged in providing clinical care. More information on Dr. Bowling is available on his website, www.neurologycare.net. We're pleased to have him join us to present this important topic. Dr. Bowling, thank you for being with us this afternoon, and I'll turn it over to you.
Great. Well, thanks for the nice introduction, and pleasure to be sharing this information today. This is a topic that's near and dear to me. It's kind of personally, I'll kind of give you the backstory to my career and how I got interested in this area. But then, as Kamani was doing the introduction, and more recently, as people do the introduction, it used to be like, yeah, I did those things, but now it's like, ooh, am I getting old? Or that was a lot of things along the way there. So that's what I'm going to try to share. And that's part of why I was interested in doing this program, that I can give you kind of the facts, the scientific and clinical reasons for what I'm going to talk about. But I've now used this approach for 25 years with my patients, and I can kind of see the outcomes. So we'll get on to that. Before I kind of dive deep into it, I'll just kind of give you the background for how I got to be doing what I'm doing. So I'm in Colorado now, been practicing here 25 years. I grew up here. After high school, I left for 20 years, and I got well, back when I grew up here, 1960s, 1970s, Colorado was very healthy lifestyle oriented, like it currently is, and also open to considering unconventional medical therapies. So that's kind of the environment that I grew up in. And then I left for 20 years and got very traditional academic training. I was heavy into the academic track. And then once I got multiple years into that, chose to move back to Colorado and kind of go into community practice. So that was a huge pivot in my career and my personal life to make that change. But when I came back to Colorado 25 years ago, I thought, wow, I've got such a gigantic toolbox. I was at Yale and Harvard and University of California, San Francisco, and I got a PhD in pharmacology along the way, and did 3 years of fellowship training after all the usual medical training. So yeah, like I said, I thought what other toolbox could I possibly have? And then within a few weeks, I was very humbled because I should have anticipated it, but my patients were asking me about all kinds of unconventional therapies. They're asking me about exercise and nutrition in relation to MS. And in all those 20 years of training, I had no education on these topics that my patients were asking me about, and they were quite immersed in. So that led me to use my academic rigor to start answering the questions. And when I did, I realized some of what my patients were asking me about were obscure herbs that they could die from. I didn't know that. And then others were approaches like some dietary and physical activity approaches that should be the standard of care within MS, and they certainly weren't even really talked about 25 years ago. So that became my career, to use sort of academic rigor to address the questions and concerns that I think most people with MS have, not just about medications, but non-medication approaches. So that's that. Like I say, I got really humbled and then dug down deep and started doing this right pretty soon after I came back to Colorado. So that's been my career, to write and speak on this topic, like forums like today, and then to have my clinical practice and have those two halves of the career kind of feed off of each other. And then a really rewarding element of it at this point is, I think I might have a one-of-a-kind MS practice in the United States. So like I said, I've been doing this for 25 years with my own patients. And then I'm already in a state that's very healthy living, lifestyle oriented. So I got many people I've followed for a long time who've been really diligent with this integrative approach that I'm going to talk about. And they're really remarkable to see people grow, mature, develop, and also to see some really successful ways that people have coped with their MS once they've kind of dealt with the diagnosis. Then it's sort of like, well, how are we going to move forward with this? And like I say, it's been rewarding to see how things play out. For example, I got multiple patients now who are in their 60s who've had MS for 20 to 30 years. And you'd think they had talked to each other, but I don't think they have. But they come in at some point and they say, this is the weirdest thing. I'm in my 60s and and I haven't had MS for 20 to 30 years, and I'm the healthiest 60-year-old I know. And I think it's because 20 to 30 years they've had MS, but they've also kind of cleaned up their life, lived a healthy lifestyle, found meaning in life, very kind of people with lots of psychological and physical resources that they've used optimally. So we'll get into what have I observed that works and what works based on the scientific and medical literature. So before we get going, I think this term integrative medicine, that's still not really, it's kind of a clumsy, many syllable phrase. And I think people often still aren't exactly sure what that is. It often is used to refer to kind of wacko stuff with no evidence or just one little tiny element of true integrative medicine. So the official definition is it's blending conventional medicine with lifestyle approaches like diet and physical activity, and also, when appropriate, blending it with unconventional therapy. So it's those three. So conventional, lifestyle, unconventional, in an evidence rigorous based way, like I've been referring to. And also, it's not just that, it's not just bringing those three together. It's also focusing just as much on preserving someone's health, like preventing disease, as treating disease. Much of American medical care, it's really kind of waiting until a disease happens and not so much the preventive, healthful approach. And then also it requires that this can't work with sort of the paternalistic old school medical care model, because this really is a collaborative approach between a clinician and a person with MS. Because for some of the things, the clinician is writing the prescriptions and really calling the shots and in the driver's seat. But then for some other approaches, especially the lifestyle approaches, that's really the person with MS who has the responsibility, the accountability on that side. So I'm not sure they still have these, but when I'm seeing my patients, I often have this image in my head like the old school driver's ed cars, where you had the teacher on one side and the student on the other side, but there was actually a steering wheel on both sides, and really feels you have to have that because your clinician can't be tracking some of these things that really are, like I say, responsibility, accountability for the person with MS. So I defined integrative medicine. So then how do you apply that to MS? That's gigantic. You know, we often think, well, MS conventional therapy, that's gotten very complicated with all the medications we have. Wonderful that we have the medications, but it's quite complicated. So then how do you add in unconventional medicine and all these lifestyle approaches? So that's been a lot of my career. How do you put this into a package that's understandable, accessible, something that people really can do in a practical way? So I kind of think of this in 7 steps. We'll take time with each of the steps, but just to kind of give you the overview, and I'll focus more on some steps than others, just given the time that we have. But the 2 steps I think many people are familiar with. One is disease-modifying medications, so the conventional MS medications, and then the other is managing symptoms, but not just with conventional medication, managing symptoms, thinking about lifestyle and unconventional therapies that might be helpful as well. And then 5 others. So it's kind of 2 that are probably quite familiar, and then 5 others that may be variably familiar with people out there. So the 5 others, like I said, I've just given the over 30,000 foot view to begin with, and we'll kind of dive down deep. So the 5 others, one is physical activity, the other is diet, another is social and emotional well-being. The 4th one is tobacco and alcohol. And the 5th area is keeping the rest of the body healthy. So now we'll kind of get into those in more detail. So the first one that I brought up, the MS medication, that's not the focus of the program. I think those are important. It's amazing the advances we have, all the new drugs are not just look-alike drugs for old drugs. Some of them are totally novel, and we now have some approaches that can be used for progressive MS. But that's all I'm going to say there. That's not the focus of the program. Second area, symptom management. I'm not going to get into the conventional approaches, but I think it's important to keep in mind that a lot of MS symptoms, there are unconventional and lifestyle approaches that can work quite well. So I think it's important for people to be aware of those. And at the end of the program, I'm going to give people references on where you can go to find a whole lot more information. So certainly, you know, some of the common mood issues that people have with MS, depression, but also anxiety. There are lots of unconventional approaches that can be used there. Those are typically physical activity based, but they're unconventional physical activity approaches, mind-body approaches, meditation, mindfulness that can have benefit. Some of those same approaches can help with fatigue and pain. So I thought this was interesting. This was a while ago, but 10 to 15 years ago, when I really started incorporating some of these approaches in practice, if someone came in with some mood issues like feeling sad, but not severe depression, sort of borderline depression, and for example, they had stopped exercising as much as they had been, I would tell them, I just sort of made this term up, but exercise withdrawal syndrome, I talk about that. If people have kind of cut back their physical activity program, you get all these therapeutic effects from physical activity. So if you cut back, it's like you're withdrawing from this amazing therapy that you've been using. But like I said, back 10 to 15 years ago, I would tell people, well, before we even think about like an antidepressant medication, let's just have you ramp back up your physical activity program. And it didn't happen, but I got very close to being fired by a couple of patients back then, because it just was not, if you have a new problem when you're seeing a physician, back then it was like, well, you better leave with a new prescription and kind of add up medication. So that's not so much the approach now, but I think there still is much more ease of clinicians going to the conventional side as opposed to thinking about, yeah, maybe there's a little less evidence for this other lifestyle approach, but it has little to no risk and may well be what's needed. So that's, like I said, that's gigantic territory, how to manage MS symptoms with unconventional lifestyle approaches. Like I said, at the end, I'll give you some references where you can go get more information. So now I'm going to talk about the 5 other non-drug based approaches that are, I think, talked about more than they were even 5 years ago, but really incorporating them into clinical practice, I think still not so much. It's really not part of the kind of core of the therapy that a lot of people with MS get. So first one is physical activity. Like I said, back 25 years ago, amazingly, physical activity was viewed as alternative medicine. When I saw that, I thought, wow, there's my career. If exercise is alternative medicine, I had to change some things here. Educate the public differently and clinicians. So yeah, just lots of evidence. I'm not going to go through it in detail, but physical activity can improve many of the symptoms of MS, can potentially help have a disease modifying effect, like decrease the chance for attacks, decrease the chance for disability progression. Even if you have normal physical function with your MS, normal neurological exam, I think it can still be really helpful to meet with a physical therapist just once. Physical therapists are really the ones to develop an exercise program. That's a conventional program, and then there are lots of they used to be thought as unconventional, but now they're pretty mainstream. So certainly yoga is one that was thought to be sort of on the borderline 20 to 25 years ago. That's now, so it's sort of mainstream, but lots of potential benefits with yoga. It's been studied specifically in MS, potentially helping multiple symptoms like fatigue, strength, muscle stiffness, walking stability. Some similar findings with Tai Chi. Both of those can potentially help with the mood side, anxiety and depression. Something that's used a little less frequently, surprisingly, is Pilates. And the Pilates really focuses on the core muscles. A lot of people with MS, their most vulnerable muscle group are their hip flexors. And the hip flexors are a part of the body. The hip flexors feed into the core muscles, and the core muscles are a challenging part of the human body because they're so important, and I think a lot of people just don't know how to activate them. And if you don't know how to activate them, it's hard to exercise them. So I think Pilates is a great way to, first of all, just figure out how do you turn on the core muscles. And they're really muscles kind of rhythm. It's not like you're not aiming to get a six-pack. That's sort of a American view of what the core muscles do. They give you a six-pack, but it's really more, that's not really their intention. They're designed to be muscles of rhythm, so they move with you when you're twisting or when you're walking, just that the whole torso part of the body to use that rhythmically and in a non-stressful way. That's kind of how I envision the core muscles. So yeah, Pilates, and like I said, that's a great way to, first of all, just understand how do you turn those muscles on. And that gets to something that I think of yoga and Tai Chi, like Pilates, like what great ways to just learn about your body. You can do that with physical therapy as well, but I think that's a challenging aspect of MS, especially if you're someone who didn't do a lot of sports, you don't really understand the physicality of your body well, and then you have MS and it takes away some of the physicality. I don't think there's anyone in the world who, if that's who they are, 4 weeks of physical therapy can't not teach you about the physicality of your body, so then you can optimize a physical activity program. You have to learn about the physicality of your body. How do you turn on the core muscles? How much should you push yourself physically? How close to the limits of function should you get? That takes a good year or two, I think, to just get that understanding, to then use that, to kind of have that in your toolbox. So yeah, like I said, yoga, Tai Chi, Pilates, just your own physical activity program, but done in a thoughtful way, can kind of give you that education. It's often interesting that, growing up in school, we had PE classes, physical education. And then, I don't know, somewhere high school or a little beyond that ends. But then our bodies change and things can happen like MS. And we just need to give ourselves some leeway for realizing that sort of physical education you need and how to use that for your body, that probably changes quite significantly every couple of years for all of us. So this is some thoughts there. In terms of kind of the concrete aspects of it, I typically think of physical activity 3 to 4 days per week, 30 to 60 minutes per session. You want it to involve strengthening and balance, not just aerobic and conditioning. Roughly, the aerobic to conditioning should be a 2-to-1 ratio. And then something that I think is often left out of American exercise programs is just relaxing. That is a part of Tai Chi. It is a part of yoga. It's part of a lot of Eastern-based exercise. But, with physical activity, you've got endorphins. It can be an enjoyable experience to have the endorphins. Also, maybe more of that exercise benefit that you feel emotionally is related to marijuana-like chemicals, endocannabinoids that we make in response to physical activity. But I think I would encourage you, if you don't do it, to just have relaxation be some part of your physical activity program. You don't have to get into some deep meditative state or have a special room. You can just lie on the floor during or at the end of your physical activity, close your eyes and relax. And then you probably heard of Pavlov's dog. You can condition the body to do things if you sort of combine two experiences. So if your body's chemically in a position to feel relaxed, and then you tell it you want it to relax, that can then make it easier to feel relaxed at times when you don't have sort of the chemical inducement of it by exercise. Another important piece of the physical activity side is to just have fun. And I got to say, when I first got into that, in all those years of medical and scientific training, I don't think the word fun came up at any point along the way. But that's something that I certainly talk with my patients about. An exercise program is almost certainly not going to stick if it is not fun for you. So that's how I kind of relate. If you really don't like the exercise piece, you do it by duty, but maybe you like the relaxation part. You can just do the physical part, do it by duty, and then have fun with the relaxation piece. A few other side comments, something that I have a lot of patients who have gotten into a different type of exercise over the past several years. And maybe some of you have heard of this, high intensity interval training, HIIT, HIIT. So that's the acronym for this. That always sounds daunting. HIIT, are you going to do your HIIT? I always think it should be, and it's so accessible. You don't have to be Olympic sprinter to do this HIIT training. I sometimes joke maybe it should be kind of intense sprint, like, so KISS would be the acronym there. Does this make it a little user-friendly? Because this is so accessible, it's free. And basically what that is, I don't have time to get into it in detail, but it's basically repetitive, repeating sprints, kind of all out if you can do it. If you can't do it all out, to do as much as you can, and to do like 30 seconds on and then 2 minutes lower intensity, and then 30 seconds on, 2 minutes at a low intensity, and to just do 5 of those. And if you do the math, that's only like 15 minutes. And there are more than 1,000 studies in the general population showing that that's certainly better for your overall health, cardiac health, lung health, weight management than 45 minutes to an hour of moderate exercise. So like I said, it's lots of studies in the general population, more than 1,000, and a couple dozen studies in people with MS. Most of those studies are, for some reason, have been conducted in Europe. But that's something, and they've done studies recently looking at people who just have never done anything athletic. They've had trouble with exercise programs even. And those people find this more enjoyable than a conventional moderate exercise program. So there's something about kind of the all-out aspect of it that's compelling, and you're kind of competing with yourself, and you don't have to really, you don't have to measure heart rate. It can just be your own sense of physical exertion. A couple other important exercise elements. One is there is not one best MS exercise program. I think it's really something that you want to tailor to yourself. It's also interesting that there are these exercise regimens like yoga or Tai Chi or Pilates, and then we try to insert ourselves as unique individuals into these exercise programs. I think for many people, the best exercise program is the one that's tailored to who they are, and that takes a while to figure out. You got to understand your physicality. You got to figure out limitations you might have due to MS, but physical therapists are excellent professionals to help you kind of develop your own individualized program. Also, if you're listening to this and you've never exercised and you just want me to get on to the next topic, one thing that I've found probably the most successful in my patients has just been to start small, like start ridiculously small. For example, 1 minute exercise program that you do 3 days a week. And you do that for a couple of weeks. And then you go up to 2 minutes for 2 weeks, same frequency, 3 days a week. And then you just keep doubling every 2 weeks. You can even double every month. And like I say, that's the trick that's worked most frequently with my patients, for people who just couldn't get anything going. So the number 2 area in these kind of 5 non-drug approaches is diet. I think often when people think about diet, they immediately think about dietary supplements. And I think that is something to think about with MS. The 2 that I think warrant the most consideration are vitamin D and vitamin B12. So vitamin D may well have a disease-modifying effect on MS, could decrease risk for attacks, decrease risk for progression of disability, decrease risk for MRI lesions. The data is not perfect. The world-class studies, or some of them are still pending, but there's certainly lower class studies, observational studies. There are more than 100 now suggesting higher vitamin D levels are beneficial for MS. As with many nutrients, vitamin D probably looks like it has a Goldilocks phenomena. What that means is you don't want too little and you don't want too much. You know, in the middle is just right. There's nothing new about that, but when we identify a benefit of a supplement, often it gets into that idea, well, more is better, and then people take gigantic doses and get high blood levels. But certainly for many of the health benefits of vitamin D, if you get the level up to a certain point, you have beneficial health effects. And then when it gets up too high, then it starts going the other direction. So what I just described, that relates to some forms of cancer, relates to bone density. Too much vitamin D, you can actually have decreased bone density, increased risk for fractures if you get too high a level, heart disease. If you look at overall death risk, it sort of goes down with vitamin D to a certain point, and then it starts going up. So then the question is, well, what's the low point there? And if you look at the studies that are out there, the low point is you want to, or where does it start going up? So it's for the blood level, you want 30 to 55 roughly, or the dosing you want to keep at or below 4,000 units. So that's our, that's the balanced approach to vitamin D. Vitamin B12, that is not a sexy nutrient, but there are people, a subgroup of people with MS who are at risk for vitamin B12 deficiency. That data goes back a few decades, and then vitamin B12 deficiency is now more common, probably because of the use of various, some antacids that decrease vitamin B12 absorption. Also some oral diabetes medications can increase risk for vitamin B12 deficiency. And the concern is B12 deficiency can mimic a lot of the symptoms of MS. So you don't want to be having symptoms thinking it's MS, and then you're doing MS symptomatic medicines, or you're changing your MS disease modifying therapy. And in the end, you really just are slowly developing vitamin B12 deficiency. So to me, that's a critical one to check. But yeah, like I said, it's certainly not very trendy. So to me, those are the two supplements that everyone with MS should be aware of, and have blood tests at least once along the way to kind of see where you're at. In terms of other supplements, you got to be careful. You know, the list I have, there are now more than 200 different supplements that can potentially be harmful to people with MS. A lot of those are supplements that can activate the immune system, which can negate the effects of MS medicines, or just if you're not on a medicine, can activate the disease. Some can worsen symptoms like fatigue. And then just in the general population, we now have more than 20 studies showing modest doses of many vitamins and minerals. We used to think modest doses of a supplement, that's going to have a neutral or good effect. That's why there used to be kind of a shotgun approach, like if it's neutral or positive, we should all take 100 supplements every day. But we now have, like I said, more than 20 studies indicating modest doses can have negative health effects. Given that situation, we don't want to do the gunshot approach, because maybe you're going to do more net negative to your body by taking multiple supplements. So it's really a targeted approach. And then, like I said, people hear diet and they think supplements. I just gave you lots of information about supplements, but where you really should focus the effort is food quality. So there are many different diets out there. I don't think we're ever going to find the one best diet for MS. I think we'll probably have already identified the worst diet for MS. Maybe that's the best we can do. And the worst diet for MS is probably the standard American diet. So if you just deviate in a healthy direction away from the standard American diet, you're almost certainly going to have beneficial effects for whole body health, and you may have benefits for some MS symptoms such as fatigue. So there's a lot of confusion out there, lots of people touting one particular diet over another, and what gets often lost in the midst of all the confusion and the arguing back and forth is that a lot of diets get their beneficial effects, maybe not from that diet itself. It's not that that diet has one magical property. It's more that people who entered into the study went to that diet, which is a generally healthy diet, they started with an unhealthy American diet and they went to that. So it's more that people have removed something negative. So what is a generally healthy diet? Like I said, there's some big diet studies currently happening in MS, but I'd be shocked if we somehow find the best diet for MS. I think what we're going to find with MS will be similar to what's been found with diabetes, weight management, high blood pressure, that there is not one best diet. And if you look at generally healthy diets for some of those other medical conditions, like the Mediterranean diet, vegetarian diet, TLC diet, MIND diet, even Weight Watchers is in this list. You look at all those diets on the surface, these generally healthy diets, they look really different. They also look kind of confused. Like, how do you compare these different healthy diets that have 15 different features? But then it gets simpler if you sort of task yourself to take each of those diets, distill down the 15 main features to 5. And then if you push yourself even further, like, of those diets, what are the 3 most important elements? And if you do that, they're all the same. And they're all the same in accordance with a quote from Michael Pollan, nutrition writer, who's written on other topics. But they all distill down to eat food, like real food, eat food, not too much, mostly plants. So if you want a particular diet, you can go research what these different generally healthy diets are. Or if you want to have freedom and you can be disciplined, then you can follow Michael Pollan's quote there. I do add my own version of Michael Pollan's quote. There's one word I put at the end, which parallels my thoughts about exercise, which is eat food, or real food, not too much, mostly plants, enjoy. So to have something that you're going to sustain over time, like with physical activity, you need to enjoy it. And sometimes to meet those other criteria and still enjoy it, that can be a little bit of a project. But if you enjoy something, we as humans keep doing things that we enjoy. We're really good at that. We're also really good at doing things we don't enjoy. So at the core, you can find motivation, fun, enjoyment as the core of why you're doing something on the physical activity side or the diet side. If you start with that, then the other stuff can follow naturally, and then it can be something that's sustainable over time. Final area to be mindful of is weight management. That's challenging with MS if people have difficulty with physical activity, burning the calories. But growing evidence that appropriate weight management can decrease symptoms of MS, might actually have a disease-modifying effect. Something else in relation to diet that I think applies to the whole integrative medicine area is that this idea that it's difficult, but it's not complicated. And if it starts feeling really complicated, like you've got to do these exact things and you have to do it with this frequency during the day, that's probably not something that's required that you do. The difficulty in these areas is not that it's complicated. The difficulty is having the discipline and finding the motivation to do the things that we all know are the generally healthy approaches. So that's the second area. That's the diet element. And then the third area is personal and social well-being. This is an area that I think people with MS can have huge growth in this area. I think this is an area, and actually all these integrative medicine approach areas, but especially this personal social well-being to really kind of optimize that. That's something you can't really get into until a year or two after you've been diagnosed. I think it takes most people with MS a year or two to just kind of process the shock of the diagnosis, take in, it's a little bit of a crisis time to kind of get educated, but also respond to this diagnosis emotionally. And it's sort of a back and forth. You take it in emotionally to a certain point before you can take in more information, and you take that in and that, and sort of that can take a year or two. But then after that, on the emotional side, the psychological side, I've seen many of my patients really use the MS diagnosis as a springboard for developing a psychological toolbox, developing what I call emotional literacy, like really becoming outstanding at identifying and processing emotions in real time. I've seen men in their 20s. Our culture does not really nurture men to be emotionally attuned, but a man diagnosed in 20s with MS, that's sort of a crash course in how do you develop emotional literacy. And that's really remarkable to see. And it makes you realize how much potential we all have if there's a big motivator there. So, and then certainly if it's more significant, medication, psychotherapy. But I'd argue if someone has really good emotional literacy, like they're identifying and processing emotions in real time, generally there's not huge sadness or anxiety happening, because often more severe psychological issues are due to unprocessed emotions. So the fourth area I want to get into is tobacco and alcohol. I'm not going to spend a lot of time on that, but tobacco use, MS is reason number 302 to not smoke. So increased risk for relapses, disability progression, MRI lesions, alcohol. We don't have perfect data there. There certainly is not evidence that moderate alcohol is bad for MS, but certainly you have to be careful with alcohol in terms of cognitive function, in coordination, walking difficulties, fall risks. And then, alcohol can lead to other adverse health effects that could then impact MS. And I'll just make a comment with tobacco, alcohol, other addictions. Well, I have multiple patients, including a patient of mine here in Colorado. He and I do some talks together where, if you've got that addiction gene, it can be hard to get off the addictions. And I have this one patient and others where sort of the deer in the headlights with the MS diagnosis has become their daily motivator to not do the addiction thing, because they know that's going to have an adverse health effect that's not going to be good for their MS. That's really powerful to see, especially people who were diagnosed with MS 20 years ago and they had addiction history for 20 years before that. And the MS is really what kind of was the best thing for their addictions. And then the fifth area, the final area, is keeping the rest of the body healthy. The medical term, which I really don't even like the sound of the term, is comorbidities. So other medical conditions that you have. And to me, this is like a missed opportunity. I think maybe thousands of times per month in MS clinics in our country. And the idea is that we have data, a lot of data recently, the last 5 to 10 years, but other data going back 30 years, that if you have MS and then you start getting other medical problems like high blood pressure, obesity, diabetes, heart disease, stroke, you get just one of those, then that can make the MS worse. It makes sense. It's kind of one machine, our body. So if you get just one of these, you can have increased risk for relapses, worsened symptom severity, increased risk for disability progression, MRI worsening. There's lots of data there. And so to me, the missed opportunity is most people are diagnosed with MS between the ages of 20 and 40. And at the time of an MS diagnosis, most people don't have any other medical conditions. They don't have any of these comorbidities. And what a great opportunity if at that point, people 20 to 40 aren't thinking generally so much about their long-term health, but to have that be a wake-up call to clean up your life, to kind of implement these 4 other steps, these lifestyle approaches, so that maybe you don't develop any of the traditional American comorbidities. So that's something that sounds a little, I guess 30 years ago, I would have thought that was really idealistic, what I just said. But I have so many patients where I've been with them on that journey, and that relates to how I started the program. People I have who are in their 60s, and they're kind of bragging that they're the healthiest 60-year-old they have, and they've had MS for 2 or 3 decades. So these 5 areas, we have evidence, I kind of gave it, for them helping potentially with slowing down the disease with attacks and disability progression, MRI activity. Where we actually have the best evidence is with that 5th area, the comorbidities, not having these other medical problems. So I'll end with, I've kind of hinted at this along the way, and I would definitely have thought this was idealistic mumbo jumbo 30 years ago when I was in my medical training, but I've seen it a few hundred times in my office, and there's medical literature to support this. But I would argue that if you have MS, you potentially have a powerful positive force that many other people don't have, because it's something that can really kind of motivate you to find more meaning in your life, but also produce some really healthy, sustained lifestyle change. So there's a study done several years ago at this point, but they looked at 100 people who had made successful or unsuccessful lifestyle changes, like sustained ones. These are not people with MS, just the general population. And they looked at the people who had made the successful lifestyle changes. How did that happen? Was that a New Year's resolution? Was that a TV show? Was it a book they read? And it wasn't any of those. It was what they referred to as a crystallization of discontent. And these were events that people had in their lives that were out of their control. They kind of came out of nowhere, and they're very charged with negative emotion. And some of them are medical diagnosis, but some just seeing someone else in a challenging situation. But those, that was, like I said, the commonality. They did like very sophisticated analysis of how people talked about their lifestyle change, and that was the thing that distilled out as the commonality for all of these people. And when I first read that paper, I thought, wow, a negatively charged life event totally out of someone's control. And that's how it feels when I'm making an MS diagnosis in my office. And then it certainly relates to, like I say, I've had at this point hundreds of people in my practice spontaneously come in. It's kind of interesting. It's sort of a very familiar scene in my office when this happens. But someone comes in and they sort of get situated very quickly, and they want to start talking before I start talking. And they say, "You're not going to believe what I'm going to tell you." And I do, because I've heard it a few hundred times, but it comes out a little differently each time. But people say, and this is usually people who've had MS for 5 to 10 years, but they say, you know, MS is actually one of the best things that happened to me because, and they say, some variant of made me find more meaning in my life day to day. And also it made me live my life in a more healthy way. And it motivates me every day to do that. So that's sort of like the real world of my clinical practice that totally jives with what's in the medical literature. And that's kind of why I do what I do. And that's why I have my clinical practice and do the writing and speaking I do and programs like this to help people with MS maybe try to get to that point sooner rather than later. How can you use this diagnosis in the best ways you can to produce some positive things in your life? So those are my thoughts. I've done lots of writing on these topics, lots of free articles out there over the years. I've worked with MSAA on this, other MS organizations have books. Amazon has the books that have lots of detail on this. My website that they mentioned at the beginning, neurologycare.net, there's hundreds of pages of free information on all these topics. So I'd encourage you to do some searching there. And you often think, I don't think any human can get A's in all these 7 areas. I think it's an ongoing project for all of us. Like I say, I think it's ever changing, kind of gets switched up every year or two. How are you going to especially do those 5 non-drug approaches? But I think that's some of the challenge of living and good stuff out of living. And some of these 5 areas, that's sort of the essence of life. And I think it becomes very individualized and a little bit of an art to doing it in an effective way and enjoyable way. So I think I'll end there and we can do some questions.
Thank you, Dr. Bowling. So to our listeners, there are 2 ways to ask questions. You can either type them into the chat box or select the raise hand feature in the app. If you're on a mobile device, click the screen to pull up the menu and select more, which is the icon with 3 dots, and you'll get a message from me asking if you'd like to be unmuted, and then you can speak with Dr. Bowling directly. But if you're on a computer and you'd like to use the raise hand feature, you can find that in the participants window. And I don't see any questions in the chat. Oh, actually, yes, I do. Question from Myrna. She says, is there any advice or an opinion for the best area to live?
Best area to live. Yeah, that's an interesting question. Certainly one of the most common symptoms people with MS have is heat sensitivity. Often it's heat in combination with humidity. That's not absolute though, but I think that a lot of people do feel better in a cooler, drier climate. But I have people, Colorado's cool and dry, and I have people from East Coast who come here for vacation with their MS and they feel the best they ever have and they end up moving here for that reason. But the people who lived here, diagnosed with MS here, and they travel elsewhere, places that are warmer and more humid, not extremely hot, but do feel better other places. So I think there might be lots of individual variability. I do think that's a factor to potentially work with if you have that kind of freedom in your life to maybe change where you live depending on how you feel in different geographic areas.
And Myrna says they say the other climate, either lack of sunshine caused MS. So is living with sunshine better?
Yeah, that's sort of the paradox with the vitamin D, that vitamin D is what can lead to our own, or sunlight is what can lead to our own vitamin D production, which might have a good effect on MS, but the sunlight is going to make you hot, too much of it. So how do you balance the two of those? So you can certainly, you get vitamin D, not just from sunlight, but in a pill, or some food has some vitamin D in it. So you're kind of balancing the two of those.
I actually do have a question.
Yeah.
Obviously, there are different stages of multiple sclerosis. Do you think that if someone who has one particular form benefits more from integrative medicine than someone who has who's at a different stage in the disease?
That's a great question. And the answer is no. Quick answer. So there's lots of benefit, and I kind of gave the data along the way. That there's benefit. There are studies showing benefit of these different approaches, not just for relapsing, but for disability. For not just for relapses, but for a disability progression. I would say specifically on the progressive MS side, I do think sometimes that's way undertreated. People's progressive MS, because we have limited disease modifying therapy treatment options. And so then I think, primary cares are maybe a little less attentive to general health issues, and neurologists feel like they have limited treatment options. In the midst of that, I think often people with progressive MS can go 10 or 20 years without addressing these 5 areas. And then it becomes kind of a vicious cycle, like they're not getting physical activity, and they have an unhealthy diet, and they're gaining weight, and their mood is getting worse. And then all of that's leading to obesity and high blood pressure and heart issues. And it's really not a good cycle. So, and I think a rich area to apply this is people with the progressive MS. Some people's progressive MS, it may be the MS itself, but also it's kind of being accelerated by not doing many of these non-drug approaches.
And Elaine wants to know if you have any advice for people who suffer with eyesight issues.
Eyesight issues, like I assume, like blurring of vision, the acuity.
I would assume so, yeah.
Yeah, I can see her nodding, I think, yes. So, if it's blurring due to the eyes not being lined up, not double vision, but a little blurring, then that's the prism lenses for that. There's some eye surgeries that can be used for that. To actually improve the acuity of the vision, that's a challenge. That's more in the ophthalmology realm, but some of that's just due to injury to the optic nerve that you can try to get recovery, like with steroids in the midst of an attack of optic neuritis. But after the injury is done, then I think it's kind of working with an ophthalmologist, and then there are various assistive devices for people with decreased vision.
I have another question here. Someone asks, I have heard organ meat may be beneficial. Is that true, or?
Yeah, I've seen that also, and I think there's some MS specific diets recommending organ meat, but there's not good evidence for that. I think where we have the evidence is where I said, real food, not too much, mostly plants. An excellent place for, I do not get any royalties from this or have any connection, but US News and World Reports, they do this outstanding review of diets. It's called Best Diets. So they just take whatever the 40 most popular diets out there and have 20 world experts review them and rank them independently. It's like Consumer Reports approach to diets. And it's such helpful information. Then they just sort of do a ranking. So anything that's in the top 10 there, those are very specific diets. And in relation to the question, it's kind of striking to see sometimes in the top 10, I think a lot of people haven't even heard of 3 or 4 of these diets where we have the best evidence. But then if you look at the bottom 5 or 10, that's often where the most touted diets are. The trendiest diets are the ones that really have the least evidence to support them.
Question from P. Myers, and they want to know what your definition of real food is.
Real food. So, not processed food, fresh produce, fresh meat. It doesn't have to be, you can have a plant-based diet, but still consume meat, but mainly not processed food and not restaurant food. You don't know what gets put into food at restaurants.
I remember seeing a couple years ago on television about a woman who has MS, and she said that she experimented with bee venom therapy.
Right.
And that's like the only time that I've ever heard anybody who lives with the disease say that actually helped them. Are there any recent studies on that, or is that one of those weird things that very seldom, I guess, is proven to work?
Right. There have been limited studies showing that that does not have a beneficial effect. In terms of the rationale for it, that actually was pretty popular 30 years ago, the bee venom therapy, and you could buy bees and apply them with tweezers to produce stings. And it's kind of interesting scientific rationale that when you get a bee sting, you got huge inflammation in that area. Mm-hmm. So to counter that, the body has to mount a gigantic anti-inflammatory response. So if it's having a gigantic anti-inflammatory response to the bee sting, then maybe it's going to do that in the brain and the spinal cord and help MS. But there's not evidence to support it, and there's some to argue that it's not effective. And importantly, some of the pamphlets on bee sting therapy for people with MS recommend doing the bee stings around the eye. Like if you've had optic neuritis, there's actually something that happens in the general public, not people with MS, called bee sting induced optic neuritis. So you can actually cause optic neuritis by doing bee stings around the eye.
Yeah,
that would not be top on my list.
Yeah, I don't think I would try it. I mean, even if I had MS, but it doesn't sound like any. I've been stung by a bee once, and once was enough. I wouldn't intentionally do it, but I think that's all the questions. So with that said, that's all the time we have for now, guys. If you missed any part of this conference, it will be available on demand on our MS Focus SoundCloud page, msfocusradio.org, and on the Multiple Sclerosis Foundation YouTube channel. And be sure to follow us on Facebook, Twitter, and Instagram for times and access information. Our next Zoom conference will be next Tuesday with Dr. Ben Thrower, and he will update us on COVID-19 and MS. Time, I don't think I said the time, but the time will be 3:30 p.m. Eastern Time, and that's November 10th. So we thank all of you for participating, and we thank you, Dr. Bowling, for spending the hour with us and for sharing this information today.
Great. Thanks so much for inviting me.